Welcome back to Health Mantra with Manipal Hospitals. I'm your host Heather, and today we're going to be talking about peripheral neuropathies. Yes, two words that you're completely unfamiliar with, am I right? How about if I say GBS or the Guillain-Barré syndrome? Now that I'm sure you've heard. Why? Well, because it's been all over the news. What with the outbreaks that are happening all over Pune, now cases in Mumbai. Headlines say rare neurological disorder, an outbreak of a rare neurological disorder, conditions that cause creeping paralysis, patients who are perfectly fine in the morning hooked onto ventilator systems by that evening. Scary, I know, and a rather strange one. So, to help us navigate the complexities of these diseases, we have here with us Dr. Amrut S D, a consultant neurologist at Manipal Hospitals, Goa. Hello, Dr. Amrut. It's a pleasure to have you here on the show today.
Thank you. Thank you.
Dr. Amrut, before we get to talking about GBS in particular, can we talk a little bit about, the broader category of conditions that it falls under?
Definitely. As such, neurology is a very complex subject, and for patients, it becomes very difficult to understand like what kind of problems they are dealing with. So, to begin, I'll just briefly introduce to the human nervous system. Now, the human nervous system, it contains of a brain, and from there, the spinal cord starts. From the spinal cord, there are the rootlets which will be traveling outside from the spine, and then they will convert into some kind of a group of nerves, what we call as a plexus. From there, the nerve will begin. Now, each nerve is like some pen, if I say. The now pen has a refill inside it, and there is an outer coating. The outer coating, we call it as a myelin. The inner side of the nerve, we call it as a axon, basically. The reason why I'm telling is there are a lot many disorders which I'll be discussing now in upcoming this thing. So there are a lot many diseases which affect the coating of the nerves or else the inside axonal part of the nerves. For all practical purposes, we can take it we can take it as a large nerve fibers and then the small nerve fibers. If somebody's large nerve fibers get affected, then one would face the loss of sensation or else the numbness. If somebody's small fibers get affected, they will start showing symptoms like tingling, numbness, and pricking sensation, or else abnormal paresthesias, abnormal sensations. So they are all the group of symptoms. So this could be the peripheral neuropathy in such kind of a patient. So peripheral neuropathy, it usually presents as a tingling and numbness in hands or else feet, if their small fibers are getting affected, or else it could be numbness, loss of sensation, or the loss of the muscle power itself. This is how the peripheral.
Now, when you say tingling and numbness, I mean, that's usually what we say, we call it ants.
Correct.
So now, suppose we sit with your legs crossed, at that time, you also develop a numbness and a tingling. So how do we know when, it could be something that perhaps requires a consultation?
Yeah. So when we sit on the crossed leg position and all, that time obviously the nerve fiber which is getting compressed at that region would cause a numbness or a symptoms in the particular nerve distribution. Now that symptom will get relieved when we just take a walk or else do some hand movements. But the nerve fiber related or else the neuropathy symptoms will be persistent, and probably during the night time when we are about to get into the sleep or else during the night time, the symptoms will worsen. And that indicates that they're persistent. Any neurological symptoms would be mostly persistent.
So it will, what you're saying is it will worsen even though, say, for example, there is no pressure being put on the nerve.
Exactly.
Doctor, with your vast experience in managing, these nerve conditions, let's talk a bit about GBS, the Guillain-Barré syndrome, which, as we all know, there has been an alarming outbreak. Now, from the little information that I've gathered, it's an extremely rare disease, one, and it's a disease where your own body attacks your own nerves. Could you elaborate a bit on?
Exactly. So this Guillain-Barré syndrome or else the GBS, GBS syndrome, GB syndrome, it's a well-known neurological entity for most of the neurologists as well as for the general medicine people. Now this is in neurological terms we call it as a polyradiculoneuropathy. Here, other than the nerves, the radicals, I mean the nerves which are coming out of the spinal cord, at that area also the nerve starts getting affected. Now this is something, there is something called as the autoimmune entity. Now Guillain-Barré syndrome, it's an autoimmune disease. The antibodies or else the chemicals which are being produced are acting on our own nerves. Now the classical history of any Guillain-Barré syndrome would be like a patient having some kind of a infection, could be some stomach upset or else the diarrhea, and or else some kind of a respiratory tract infection. Now the person will suffer with that respiratory tract infection or else the diarrhea, and he will recover from that entity, and after 1 or 2 weeks suddenly he starts complaining of some kind of a tingling, numbness, which keep on progressing. It usually starts in the feet and it keep on progressing upwards, what we call as a ascending paralysis. Gradually his legs will become weaker and then his hands will become weaker. Now the reason is the outer coating, the common GBS would be where the myelin or else the outer coating of the nerve fiber starts getting affected, and then the antibodies will start destructing the nerve. Now nerve is supplying the muscle, and that is the reason the muscles become weaker and the disease progresses. And the disease will progress to such an extent sometimes that it will involve the respiratory muscles as well. And sometimes the swallowing muscles can also get involved. Other than the weakness, the patient might complain of a swallowing difficulties, breathing.
That is if it has progressed quite a bit.
Yes, definitely. Or else sometimes it can directly start involving the muscles, or directly start involving the muscles of the swallowing as well, the chest muscles also.
So it doesn't have to start at the feet. That's
exactly.
What you're saying.
There are various types of the GBS syndromes. Now neurologist would be the best person, or else the physician would be the best person to analyze those symptoms. So it gradually progresses, and then the progression usually happens over a period of 25 to 28 days, and then it stops. Basically it worsens. The earlier we detect it and diagnose, and then the earlier we treat, the outcome would be better.
Doctor, you said progression takes 25 to 40 days, but we've also read of cases where patients have been perfectly fine when they wake up that morning and they're hooked onto ventilator systems in the evening. Is that really possible?
Yes, sometimes GBS can rapidly progress. Now it is difficult to say that which patient will going to progress and in how much time will they going to progress, and but usually the disease, it progresses slowly. It won't be so rapid onset. I mean, it is quite not possible to see in each and every patient that the morning he will be all right and suddenly he is ending up on the ventilator. So that is quite rare. It usually happens over the period of weeks in untreated cases.
Another puzzling thing about the Guillain-Barré syndrome is that we don't know why. Why, would the body attack itself? Why, if you have, say, how you said, a small infection, does it end up in, do we know why?
No, it is, there are, if you want to, if you want to test and then to know what kind of antibodies are affecting on the myelin coating or else the stem of the nerves, we can test it. But it is a kind of autoimmune response. The antibodies which are produced to kill the organism which has infected us, in a way it was trying to help us. Now it has started affecting our own own body structures. Now this is something what we call as an autoimmune response. There are other things also like GBS. There are various autoimmune diseases which can harm the human beings. So GBS
like
is one.
Sclerosis.
Definitely. Yes.
Now, GBS, as we all know, even though there have been some fatalities, it is treatable. We also know that there is no direct antibiotic. So, is treatment just symptomatic?
Yes. So, GBS, there are two options available for the GBS antibodies. Now, I know that, having said that, the GBS is the autoimmune disease. Now, autoimmune disease, nothing but the antibodies are flushing inside they are flowing in my blood. Now I need to give some medication to neutralize this antibody effect. There is medicine what we call as the IVIG, intravenous immunoglobulin. Now weight-based dosage of this IVIG is the only treatment, only medical treatment.
Are you flushing?
Yes, it will be given over a period of 3 to 5 days with monitoring of the kidney functions. It is quite a very allergic medication, but still the doctors will monitor it. It will be given under supervision. We have to monitor the kidney test. We have to give it very slowly, and it has to be given according to the body weight. Now that is what we call as a IVIG. Now second thing is something similar to dialysis, what we call as a plasma exchange or else plasmapheresis, where we will be filtering out the antibodies from the body of the patients who is affected with the GBS. So these are the two modalities which are available for the GBS.
Would it go away on its own? Like, does the body realize that it is attacking itself and stop?
As I have said, the disease progresses for up till the period of 28 days. I mean, based on the data which we have seen earlier. Now, this is the thing which is happening in Pune. It is not the only outbreak. Basically, even in 2016 and 17, the Peru has noticed where 700 cases of GBS have come. Now, the disease will progress, and the recovery, or as the morbidity, or as the mortality, it varies from case to case basis. It is not same for everyone. It will not progress in everybody in a same manner, basically.
So you can recover from it?
Yes, I mean, it stops by itself, basically. If it is, if the patient is not getting affected, his lungs and all, then he will be on the better side. But usually it is, the entity should be treated.
Doctor, we spoke about progression and how, it can progress really fast. Do patients recover? Can you fully recover from GBS?
Yes, definitely. If the patient has been treated early, or else if there are no comorbidities, a patient who is younger, definitely they will be having a better prognosis or else a good recovery. For some people, even after giving the IVIG medication or after doing the plasma filtration, recovery might be really slow. Here we can wait for the period of 2 to 3 weeks. And for some people, the GBS can, the strength of the person or else the neurological problems can slowly recover. It has been said that over a period of 6 months, the recovery can be noticed in almost 80% of the people. So it is a slowly recovering illness even after giving the treatment.
Is it a recurring one? Can you get it again?
Yes. So initially when the patient of the GBS comes, we will do the limited number of the tests on them, and if the recovery is better, then probably the physiotherapy and then the vitamin supplements would be sufficient for them. In case the GBS, even after treating, if it is worsening or else there is a recurrence in the weakness, then probably we have to evaluate more for in these patients. There are certain autoimmune tests, there are certain antibodies tests, heavy metal tests, or else the immunofixation panels. They are the different set of the things one needs to have a look if the GBS is recurring, or else something called as a porphyria, or else other autoimmune diseases can really cause the recurrent episodes of GBS, in whom the treatment would be different.
Different?
Yeah, it is different.
Doctor, when it comes to GBS, are there any specific tests involved to clinically diagnose that a patient is suffering from Guillain-Barré syndrome?
Yeah. As I have mentioned, the GBS is the clinical entity. Based on the history, what is being given by the patient, and then the examination will come to know that patient is having a GBS, and we immediately start them on some kind of a medications, what I have mentioned as the IVIG, or else it could be a plasma filtration. Other than this, to evaluate more or else to make sure that he is having a GBS, it is always advisable to do the nerve conduction test, which we are going to discuss. And other than that, there is something called as a lumbar puncture, where the needle will be inserted through our spine, and it is totally a safe procedure. It is having a very less pain. Now this test will be, by doing this test, will assess the cerebrospinal fluid, which is the brain fluid running through our spinal cord. Now it is also the test which can give us the idea that patient is having some kind of a
this is only for GBS?
Yes, this is for the, I mean, usually the test will be kind of if two things we can make out, like whether the patient is having some kind of an infection or else it is something else. In case of a GBS, yes, there will not be any kind of an infection, as it is an autoimmune related process. The protein levels will be very high and then the cells will be very low. Now this is a supportive kind of a test. So nerve conduction and then the lumbar puncture test, they are necessary in patients who are having the GBS.
Doctor, I mean, it's a scary thing. It's a rare one. How about prevention? Now, it is caused by a pathogen, which is your Campylobacter jejuni, which yes, also causes something as simple as food poisoning. Exactly. Now, from a food poisoning to an autoimmune disorder, that's quite a stretch, but it can be prevented. Can you tell us, tell our viewers, what they can do better to prevent something like this from happening?
Exactly. So Campylobacter jejuni is not only the organism which will going to cause the GBS, or else the complication of the only infection is not the GBS. There are the other infections like norovirus, Zika virus, which we have witnessed in the past, and recently the pandemic which happened, COVID. Now, even these kind of viruses can also get complicated as a cases of Guillain-Barré syndrome.
So it's not
Yes.
just bacterial.
Not just the bacteria. There are viral illnesses can also get complicated, or else the patients might end up in having the GBS. Now, as such, there are no vaccines or else the no medications to prevent the GBS, and sometimes the vaccine can also trigger the such kind of a GBS cases. So the best prevention would be to maintain a hygiene. It is always advisable to drink a boiled water. The hygiene has to be maintained. The food, the fruits and everything has to be in a hygienic manner. So that is the most important thing. Maintaining the hygiene is the most important thing for GBS.
So, like in Pune, they suspected that it was contaminated well water that was causing cases.
Exactly.
So, what you're trying to say is something as simple as food hygiene, heating your food, boiling your water.
Yes, that would be the prevention would be the best thing here. As such, there is no preventive medications available for the GBS.
We've spoken about the Guillain-Barré syndrome. We've spoken about peripheral neuropathies. Now, Guillain-Barré, as you said, is a very rare disorder. But there is another neuropathy which is more common, which is your diabetic neuropathy.
Exactly.
Can you tell our viewers a bit about what exactly diabetic neuropathies are?
Yes. Now, when we talk about the causes of the peripheral neuropathy, so there are many causes. Diabetes would be the most common cause. But other than that, if I say the mnemonic like starting from the A, alcohol, B would be the vitamin B12 deficiency, some chronic illnesses like chronic kidney disease or else cancers, D would be the diabetes, which is the most common one, E like endocrine neuropathies, like any patient who is suffering with a thyroid illness can also end up in having the peripheral neuropathy, F for excessive fat in the body, that is a dyslipidemia, abnormal fat levels can cause, sometimes genetic entities, heavy metal poisoning, which we commonly see in case of some uncertified Ayurvedic medications which are loaded with the heavy metals, that can also cause, and rarely the infections like HIV, hepatitis B, hepatitis C, all of them can cause the peripheral neuropathy. And some of the diseases will affect the inside stem of the nerve, what we call as the axon, and some of the diseases will affect the outside part of the myelin or the coating. So when we talk about the diabetic neuropathy, yeah, it is most common, and mostly we see the many patients in the OPD with diabetic neuropathy. Patients are presenting in a similar way. For some patients, if the small fibers are getting involved, they will present with the tingling, numbness, some and crawling sensation, or else the pin pricking sensation, or else if the large fibers are getting involved, they would end up in having some loss of sensation and muscle weakness.
But what exactly would elevated sugar levels, which is essentially in the blood, have got to do with, say, nerves?
Yeah, the elevated blood sugar levels will injure, the microvascular injury could happen. There are some blood vessels, there are some small blood vessels which supply the nerve basically. The nerve also need a nutrition, and the affected blood supply to those nerves will cause this kind of a injury to the nerve, and then the patients will have this kind of a neuropathy.
So then there is no treatment directly. I mean, you cannot treat the neuropathy directly. You treat your conditions that cause the neuropathy.
Yes, definitely. We'll discuss that thing in the treatment part. There are two things, like the causes which I have mentioned. We have to definitely manage those underlying causes, and to manage the symptoms of the nerve fibers, like there are painkiller medications, what we call them as a nerve painkillers. So these are the two modalities of the treatment.
Doctor, before we talk about your nerve pain medications, can we talk about the tests? Now you said, there's tingling, there's numbness, but are there any specific tests involved that tell you for sure that, this is what you have?
Yes. So the clinical signs and symptoms are the most common, and when the patient complains that she is having so and so problems, depending on the large fiber or the small fiber, we would just examine them in the OPD. During the clinical examination, there are various jerks and all what we have to see, and we also test for the sensations, whether the patient is having a loss of sensation, pinprick, cotton cotton touch, and then the vibration, joint position. There are the various sensations. We have to examine them. After that, there is something called as the nerve conduction test. Now, nerve conduction test, it is a test which is done in a particular room at a particular temperature, where the milliamperes of the current is given to particular nerves in our body. Say in my right hand, left hand, I will assess the two nerves, the important nerves, or else in the leg also I will assess the important nerves. Milliamperes of current will be given, and then we'll assess the potentials what can be generated. We see something on the screen like what kind of a velocity they are having, how much is the amplitude, what is the duration. So based on these things, we'll come to know like what kind of a neuropathy are they suffering with, like whether it is the coat or else the axon. Okay. And sometimes if the coat is affected, yes, that condition is quite more treatable. Like we can use the medication to treat that condition. In case of a stem is getting affected, we have to manage the underlying condition and we have to treat it supportively.
When you talk about treatment now, there are nerve pain medications that doctors prescribe. You were talking about that, but many people stop taking these, medications because of side effects.
Exactly. So, nerve pain medications, there are hardly 3 or 4 nerve pain medications what everyone would use, and it depends on each person to person basis, like case to case basis, like this medicine will going to suit him or not. The most common side effect of these all nerve painkillers is the sedation. So, it is always advisable to start these medication very slowly. And the second most common problem with the nerve pain medications is addiction. Sometimes the patients might get dependent on those medications. So it is not advisable to give them in a very long period of time, and it is not advisable to start them at a very high dosage. For example, person who is having an allergy or else asthma, these medications have to be given very cautiously. Now again, if I mention those kind of a nerve painkillers would be gabapentin, pregabalin, duloxetine, tryptoma. If the person is having another kind of a comorbidities, it is very important to choose the right medication in him. Many patients will be having some restless leg part. In them, few of these medications will help and few of the medications would definitely worsen them. So in a long run, yes, they will not directly affect on the kidney, but person may get addicted to those medicines.
What about other forms of treatment that is, not medicine as such? So things like maybe nutrition, supplements, B12.
Exactly. So as I have mentioned, B12 is also one of the most common vitamin deficiency which can end up in having the neurological problems. Yes, supplements definitely, these days we know that many of them are taking the supplements, or sometimes they purchase it over the counter. But yes, it is always advisable to take the B12 at the right time. Like vitamin B complex is something what the water soluble vitamin, like okay. It has to be taken before having the food basically. Now if I talk about the vitamin D, E, K, they are all the fat soluble medicines. True. They are supposed to be taken after having the meals, yes. Because the fat will have the better absorption of these medications. It is also advisable to check the levels of vitamin B12, because if someone is really deficient in vitamin B12, probably the oral medication will not going to help him. He might need a course of a intramuscular vitamin B12 induction, okay. Injection for the particular period of time.
Doctor, we said about treatment. Now, what about prevention? Are these diseases, really preventable, or is it more just about, say, managing your risk factors?
Yes. As such, when we talk about the prevention of the peripheral neuropathy, as we talk about the management, it is all about like managing the underlying condition is very important. If someone is exposed to the alcohol, or else someone is lacking the vitamin B12 in his body, or else someone is diabetic, or else someone having some thyroid issues, or else taking some heavy medicines, toxins, yes, definitely the first and foremost thing would be to cut those things or else treat the managing underlying condition. Now, second would be the healthy lifestyle. Healthy lifestyle includes a good food or else the healthy diet. If your food is rich in antioxidants or vitamin supplements, micronutrients, yes, definitely you can prevent the unnecessary peripheral neuropathies. Like if you're having a green leafy vegetables or else the adequate amount of fruits in your body, so it can help you in giving the micronutrients as well, vitamins as well. Along with that, it can also improve your immunity. In that way, you'll be staying away from the many infections and you'll be getting lot many antioxidants. So food is the one thing. Second one would be the physical activity or else the exercise. Exercise will help in many ways. Exercise has the immediate effect as well as the long effect as well. Now exercise can help you in, yes, improving your immunity, improving your muscle mass. In a way, your nerves and then the muscles and then the bones would become stronger. Yes, you'll be having a very less chance of getting some unnecessary infections or else some inflammation in your body which can cause this neuropathy. In that way also we can prevent the peripheral neuropathies.
Many people may not recognize the early warning signs. How crucial is it for them to educate themselves, to get an early consult on something like this?
Yes. So if someone who notices some kind of a unusual sensation in their feet, if there some kind of a burning, tingling or else ant crawling sensations which are persisting or else they are worsening in their night time and they are having other kind of a comorbidities, it is definitely advisable to meet the doctors. Other than this, sometimes patient may also feel little bit unsteady while walking, because our nervous system, to maintain our balance, there are 2 or 3 things. One would be the brain, ear, eyes and your nervous system. Imagine if you if you can close your eyes and then try to maintain your balance, it is possible. But in some patients in whom the large fibers of the nerves are getting affected, they would not be able to stand by closing their eyes, because that sensation need to be sent to the brain through these kind of a large fibers. There are many neuropathies which can affect these large fibers and cause problems like unsteadiness and then the balance issues. If someone having these kind of issues, it is better to consult a doctor and get evaluated for the treatable causes of the neuropathy.
Dr. Amrut, one last question before we wrap up. What would be your key takeaway message for our viewers, especially regarding nerve health?
Yes, as I have mentioned, it is all about staying away from the toxic substances, could be smoking, alcohol or else some unhealthy lifestyle. It is always advisable to have a healthy diet, have a nutritious diet, watch your diet, how much protein are you taking, how much fat are you taking, avoid the sugars, avoid the ultra processed things when it comes to the diet part. Second would be the physical activity. 30 minutes of a brisk walk or else 100 per day or else 150 minutes of a brisk walk per week is always important. It is, other than maintaining your cardio, it is also important to gain the muscle mass, like put on the weight bearing exercises, put on the strength bearing exercises. It is always important to get checked your levels of the vitamin or else test your routines. If you are really deficient in one of them, it is always advisable to take the multivitamins as advised by your doctor as per the recommendation.
Thank you so much, Dr. Amrut, for sharing your time and your expertise with us today. It's been such an absolute pleasure having you here on the show.
Thank you. Thank you very much.
To all our viewers, we hope today's episode was both informative and empowering. Remember that simple things like maintaining a healthy lifestyle, practicing good hygiene, and being mindful of your health can go a long way. Most importantly, never ignore persistent symptoms like numbness, tingling, unexplained weakness, as Dr. Amrut just told us, because early detection can make all the difference in the world. If you have any more questions or you would like a consultation, Dr. Amrut is available Monday through Saturday, 10 a.m. to 5 p.m. at Manipal Hospitals in Donapola, Goa. That wraps up today's episode of Health Mantra with Manipal Hospitals. I'm Heather saying bye for today. Until the next one, stay healthy, take care of your health, and keep watching Prudent Media.